Hi, my name is Dr. Raja Adnan Ahmed, and I am a consultant psychiatrist working in UK. And with me this morning is Dr. Anoop, who you may have already seen on my YouTube videos or the Facebook page. Dr. Anoop is IMG from India, and he's been working in A&E as a trainee. He's now ST3 working in Wessex, and he's already shared his experience of securing how to secure A&E training. And now we planned this session to answer some of the other questions which keep coming up about A&E, which could be about the training, which could be about the rota, which could be about the job situation in UK. And again, we will touch a bit more upon how to get into the A&E training and what could be done to improve your chances. So Anoop, thank you very much for joining me again and doing this session.
Thank you so much, Raja, for having me this morning.
So Anoop, let us start with the worry which a lot of IMGs has that UK is getting saturated. There's no more jobs left. I think COVID has sort of made things a bit worse for IMGs as well in some ways. So, but I wanted to ask you from being working in A&E on the front line, what is your experience of what is actually going on in NHS, and are there jobs, and should IMGs be worried about it?
Uh, I think, Raja, saturations for A&E jobs in UK, I think that's a myth actually, because working on the front line because of the COVID and things, it has even created more job opportunities for the IMGs. The only issue would be with regards to the relocation to the UK, issuing of cost that might take some time, but there are lots of jobs available. Uh, the other thing is that people have to refine their search criteria when searching for jobs. Now, lots of A&E trusts have come up with lots of fellowship kind of jobs where you spend 70 to 80% of your time working as an SHO or a junior doctor in ED, and the remaining 20 to 30% you can utilize it for your personal development. For example, some of the trusts have come up with fellowships like innovative fellowship or simulation fellowship, where you spend 70 to 80% of your time working in ED as a junior doctor, and then the 30% you can do some simulation practices, you can do some pediatric medicine, or you can do some expedition medicines which interests you. So these are the fellowships that some of the trusts have put forward, which makes it more lucrative for people to apply. And I think people also should look at these job adverts, which will interest them. The other thing is that, yes, most of the IMGs, they browse into the NHS jobs for applying, but they should also be aware that there's a separate NHS jobs website for Scotland and Northern Ireland, which is also part of the United Kingdom and which might have more job adverts in addition to the NHS jobs that they look for. The other thing is that normally in UK, the academic training starts in the first Wednesday of every August. So right now, the recruitment for the training is currently on, and all the trusts will get the confirmation of how many SHOs they'll be getting, or how many middle grades they'll be getting by the end of June, July, because of the COVID. And post that, I think more job adverts might come up in the NHS jobs website, and I think I would suggest all the IMGs to keep an eye on that. The other caveat in not getting the right job is your refining of your resume, actually, because resume is, or your writing a CV is not just filling up all the pages with all your experience, but you need to answer as per the specifications mentioned in the job adverts. And I think the NHS jobs has beautifully mentioned what are the requirements and specifications, and if you tailor your curriculum vitae or your resume according to that, then there are high chances that you might click the job, or you'll be offered a job in the specific trust or the position that you want for.
Thank you very much for sharing these tips. I think I just wanted to mention that we are recording this interview in March of 2021, and as Anoop was mentioning that uh, currently actively the recruitment for national recruitment is going on for all specialties, and once the trust will start getting confirmation of how many trainees are coming to them, so they can sort of then look practically of how many places would be empty, so then they can start recruiting for non-training jobs. So it is very common for us to see around June time to have more and more jobs for non-training posts coming up on NHS jobs website. So if IMGs are looking for jobs, I think that would be the best time. I'm not saying that the recruitment is not going on right now, but I think it will increase much more around June time. Thank you very much for sharing that tip. And I think the other thing you mentioned is also important, that because some of the trust or some places like Scotland and other places as well, which where they struggle to attract doctors, they are trying to create these innovative posts where they are offering doctors um, opportunity to have some personal development as well. Like for example, you mentioned, I've seen it not just in A&E but in other specialties as well, in medicine, in psychiatry. They'll say 70% of your job would be clinical, 30% you can go and do some research, or you could do some teaching, you can do some other stuff. So I think that is very good for developing your CV as well, especially if you're coming from abroad as a first job in UK. um, there's another thing called MTI scheme, and I understand there is an EMTI, which is specific to A&E, which has been part of UK's training system or recruitment system. Uh, Maybe people are more interested in that. IMGs, how would you explain that to them?
Yeah, the MTI system was renamed as EMIT with regards to the emergency medicine by the Royal College of Emergency Medicine, and they have been recruiting lots of candidates from abroad using the route called EMIT route. It's EMIT, and further information can be obtained by visiting archem.ac.uk. Because of this COVID situation, the scheme has been paused for some time, and I think it's due to start soon. Further information can be available on the website mentioned. Because and as most of the IMGs are aware, you can take these RChem, MRChem exams in India and abroad. Because of this COVID, lots of exams have been postponed, and some of them are waiting desperately to get the MRChem done to get the GMC registration. I think it's a good opportunity for them to look for the further updates regarding the EMIT program, so that if you're not clear the exams, you might find an opportunity that they might sponsor you for the GMC, which will help you relocate to the UK and start your first job in the United Kingdom.
Okay. Um, and I mean, you work in A&E and doing a training there as a SCC. People would be interested to know if they want to take up that training. How would what should they be doing, and how would they go about, and what are the basics of A&E training basically?
Perfect. So A&E training in UK is a 6-year program. Okay, so you have two forms of it. One is called the coupled training, where it's a run-through training. You start from ST1 and finish in ST6. The other one is an uncoupled training, where you apply for ST1 post, you go up from ST1, ST2, and ST3, and then you reapply for your ST4, ST5, ST6 in a separate interview. There are pros and cons for each of these, but if you are interested in ED and you have fixed your mind saying that I want to do ED job, especially for an IMG, it is good to take the coupled training or the run-through training, because it might be beneficial with regards to your visa, your relocation, and things of that sort. And you don't need to reappear for an interview. So it's a straight run through. You apply in ST1, start in ST1, and then you run through and then finish off in ST6, and then you become an ED consultant. So the format of ED training is the first 2 years, you call it as the Acute Common Care STEM, ACCS, which is the platform which you enter into ED. So in the first 2 years, you will have 6 months of emergency medicine, 6 months of acute medicine, 6 months of intensive care, and 6 months of anesthesia. And then in the third year, you'll go back to your parent specialty, which is your emergency medicine. In the third year, you will get good exposure to pediatric emergency medicine. So you'll have at least 3 to 6 months of pediatric exposure. And then you step on to your higher specialty training as a registrar from ST4 to ST6. With regards to the routes of entry, as I mentioned, if you enter through ST1, then you enter through the ACCS route. The other route is called the DREAM route, which is the defined route of entry into emergency medicine. So basically, you apply through this route if you have prior E&E experience, and then your training, you'll be doing 2 years of ST3, and then ST4, ST5, ST6. So basically, you'll be having 1 to 1.5 years less when compared to the ACCS training. With the new GMC regulations, you will get a CCT when you apply from ST1. And if you have done at least 5 years through your DREAM program, you will be getting a CCT. I think, if I'm right, from ST4, if you enter, you still get CSER CP, but not a CCT if you enter from ST4 training, which is the third route of entry, where you say, I've done things, or some people would have done their bits, and then they would have started their experience prior as a registrar, worked as a prior as a registrar, and then they want to apply directly into ST4, they can do that. But I think as of now, it will be just a Caesar CP, and you'll have just 3 years of training. The currently from this year onwards, the recruitment, they also have to give the multi-specialty recruitment assessment exam, like they do it for psychiatry and GP exams. And once you have qualified through that, then you will have the interview process, and then based on that, you will be recruited for your ACCS route into the ED. I would just like to quickly mention that with regards to emergency medicine, the curriculum is changing in August 2021, which many of them would have been aware of it. More information will be available on rcmcurriculum.ac.uk, which you can visit. So with the exams pattern, you have 3 exams, which is the FRChem primary, FRChem intermediate, and then MRChem OSCE, which is a new one, which you need to clear before you progress into your HST training. From August 2021, you have 2 exams in your higher specialty, which is your single best answer, and then you have an OSCE. And then once you finish that, you have to satisfy all your curriculum needs before you progress into a consultant. There are options in UK where you've heard about dual consultant jobs. Yeah. If you say that you feel that ED is monotonous and you want to do some other specialty, there is an opportunity for that. Currently, there are people who are doing dual training in emergency medicine and the intensive care medicine. Basically, in your ST3 or ST4 onwards, you apply to a specialty interview program for your intensive care medicine. And once you're successful, it'll be a blended training for you. You might have extra 2.5 to 3 years, depending upon your progress, at the end of which you will be a dual consultant in intensive care and emergency medicine. The other dual specialty, which is more common, is the pre-hospital medicine, pre-hospital emergency medicine, which is called the FEM training. The FEM training, again, you apply after your ST3 years, basically ST4, ST5 years. And then once you are successful to it, you will probably be doing an extra year to get into the FEM. Your ICM and your pre-hospital medicine, there are separate exams for that, for you to make sure that you are a consultant in intensive care and pre-hospital medicine respectively. The third most common specialty for the dual training is your PEM, which is your pediatric emergency medicine, which is you'll be applying through your local deaneries by ST3, ST4 year onwards, and you'll be doing an extra year of pediatric emergency medicine. So basically, you'll be doing pediatric emergency medicine in that year, and you'll have some exposure to pediatric wards, pediatric ICUs, and then post which you will be given a dual consultant or dual CCT in emergency medicine and pediatric emergency medicine. There are other fellowships which is being developed, but these are the 3 recognized one and so far, and most of the people who want to do dual training opt for any of these.
That's fine. Thank you very much for sharing that information. That was very useful. I think a lot of people will be interested in dual training. I gather, especially the newer generation of IMGs, at least from the psychiatry point of view, there are some dual fellowships in psychiatry as well. They always ask for dual because they want to learn more and sort of develop this as a consultant, have more options. Um, um, Anoop, one of the other things which a lot of people worry about, they like a lot of people, at least who contact me, they like A&E, the whole idea of working in A&E, but they always mention this rota, that this rota look very difficult, and that they don't know if that is going to be something that they will like long term. So can you tell us a bit more about the A&E rota, and should people be worried about it?
I think once you get used to this NHS system, you should be comfortable with the A&E rota. I think the rota for the junior doctors is pretty much the same in ED also. So you clock the minimum stipulated hours or the maximum stipulated hours per week as per the BMA, the junior doctor's contract. There are various shift patterns which might disturb your circadian rhythm when you start new in ED, but again, that's the same in other specialties when you're working as a junior doctor. So most of the trusts will have a morning shift, an afternoon shift, and a night shift. But in bigger hospitals, especially major trauma centers or hospitals which are slightly larger than a DGH, you will have this added on shift called the twilight shifts, where you might work from evening 4 o'clock or 5 o'clock, and it will finish at around 1 o'clock or 2 o'clock. The advantage of these shifts is you can plan your timings actually. So if you just work Monday to Friday and then Saturday, Sunday you're off, I think doing your other work and things, so that it gets a bit difficult, because on Saturday, Sunday, most of the shops or the banks or everything is closed. But the advantage of working in ED is you have a mixed thing. So you'll be working 1 in 3 weekends as per the new junior doctors rota, and you will have ops in between your normal working days or the weekdays, which in a way balances your life also. You will have enough off days post your nights and post your twilights based on your trust policies and things of that sort. But I think rest assured, you will still clock only the maximum allowed hours as per your BMA junior doctor's contract. So, it's just the different shift patterns, but the total working hours still stays the same. In fact, doing an extra twilight or a night shift will help you increase your pay also. So if you work post midnight or so, you will have extra allowance added to your monthly pay, which, like, for example, if you're doing more nights or more twilights in that month, and that month your pay might slightly raise because you get that extra allowance that you're doing in ED.
Mm.
So even if you do a Monday to Friday job, your pay is, let's say, X. But in ED, if you do all these mixed shifts, you will have X plus the allowance,
Mm.
which increases your wages, which in a way is good actually. I think being in ED for around more than 4.5 years in UK, I think it has given me a good opportunity to balance my lifestyle. People do complain about sleep disturbances and circadian rhythm disturbances, which I sometimes feel, but I think once you're used to it, it should be fine.
Mm. What about the locum opportunities? Because some IMGs might think that, is there any chance of sort of addition, as you already mentioned, having some additional income? Um, if you're working in A&E, do you get a lot of locum? I know you can't talk about the whole of UK, but what have you seen so far? Do you get locum opportunities at junior level?
Yeah, as I told you, there are plenty of locum opportunities, and with COVID coming and the sickness, striking lots of our doctors and things, there are plenty of locum opportunities available. But one kind suggestion to my fellow IMGs is, please make sure that you are used to the system before you start locuming in a trust. For example, you are used to the local policies or local things before you proceed yourself as a full-time locum there. Because although most of us are clinically sound and things of that sort, you know getting used or getting accustomed to the local trust policies is very important. Like, for example, I've been in Wessex, or if I go to northern part of the UK, it'll be the same system, but there might be some changes with the local admissions policy or local referral policies, which every locum IMG should know before proceeding to take up the locums.
And what about life as an emergency medicine doctor? Is there any tips or anything that you want to share that might help the IMGs?
Um, I think now with this COVID advent, and most of the trusts have started looking into the mental well-being of all the clinicians and the healthcare staff, basically. So they have set up lots of volunteers and psychological supports, for you to balance your life in ED so that you are not overwhelmed. I think I really love my job in ED because you see a variety of cases, and you cover a wide diversity of specialities, like ranging from orthopedics, medicine, surgicals, gynecology, and things of that sort, which makes your you know ED career very interesting, actually. Um, as it mentioned, it's about how you balance your rota with your family life, which makes you a successful EM physician. um, you have, as I mentioned already, you have regular ops in between your shifts so that you are adequately rested before you go on to the shift. But if you feel that you are tiring out or you are on the verge of a burnout, there are local setups within each hospital which you can approach, and they will be more than happy to help you. And most of the deaneries have set up their own, the PSU, which is the professional support unit in each deanery for all the trainees, which they can, seek support from. They can also speak to your educational supervisor, your clinical supervisor, or your any consultant, and they are more than happy to help you. Uh, Even there are lots of IMG groups set it up in each hospital, which is coming up, and you can approach them or speak to your peer if you are in need of it. The only thing is that if you feel you want some help, please go for it. Please ask someone, so that we are always there to help you.
Mm.
Just to mention that, for example, in Wessex, we are in the process of setting up IMG groups in each hospital, so that people feel comfortable, and they can ask their queries with regards to your life outside the hospital also. Like, for example, your how to set up set up a bank account, look for houses and things of that sort, so that all the IMGs are well supported. We are in the process of setting up, and I think uh, within a month or so we'll be able to get that running.
Then there's another question which taking up any job as an SHO, as a non-training SHO, as a first job in UK. This is something a lot of IMGs have asked me, that is that the right way to go? Because my advice is generally that this A&E is generally well supported by your middle grade and your consultant. So there's usually senior support around you, and you get to see a lot of different variety of cases that improves your understanding of how medicine is practiced in UK, and how things are working. And you get to get in touch with a lot of different departments within the hospital, and that improves your understanding of how those departments are working. Is that the right advice? Would you recommend people, if this is their junior doctor and their very first job, to be in any SHO? Would that be something that you recommend?
You're absolutely right, Raja. I think doing your first job in ED with a well-supported atmosphere helps you understand the NHS system, and then maybe if you have worked 6 months, you would know how the system works, and you are well supported by your registrars and consultants. And now most of the hospitals have started having consultants round the clock on the shop floor, which makes you well supported again. The other thing is that some of them, feel that, okay, I think. While working in A&E, I've fancied going into the specialty, and then they can, reapply as an SHO in that job, which makes them, choose a specialty wisely, rather than, applying for a specialty that you think of as fine, but after coming here, you feel that no, that specialty is not, my cup of tea, and I would like to switch specialty. I think working in A&E or acute medicine would help you understand the system better than working in the ward atmospheres or in some other specialty. I'm not against working in other specialties, but I feel the opportunities are more in emergency medicine when compared to other specialties to start your first job in the UK.
And I know, Anoop, you were planning to do some more sessions, and especially Facebook Live and some other sessions. Would you like to share some information about that? Because I know a lot of IMGs would be interested in that.
Yeah, I think last year, me and my colleague Nabil, we did a Facebook Live session, which was well received from people. Thank you for all the feedback and things. We are planning to do a session. So if people could drop in their comments about what specifically they want in the Facebook Live session, or what is the right time for us to do it, we'd be more than happy to take that into consideration. And we'll be planning for a live session soon. But we would love to have your feedbacks in the comments, so that we can plan our Facebook Live session in a more informative way.
Thank you very much, Anu, for this information. I'm sure a lot of IMGs will find this useful, and this will help them to understand the system if they want to join A&E, and take that type of training opportunities.
Thank you so much, Raja, for your time, and I hope more IMGs come into the UK to enter emergency medicine, and I'm always there to help. If you have any queries, put your comments in the comment section, and we are more than happy to answer that.
Thank you very
Thank
much.
you.